anterior, and then sagittal view. So I'm gonna have you turn your face that way. Is it okay if I palpate your shoulders, iliac crest, everything? Okay, all right, so when we're doing our plumb line assessment, okay, we're gonna be making sure we have a line, a vertical line that bisects the cranium. It goes along all of the vertebral bodies through her gluteal crease and then lands in between her medial malleoli, okay? So when you're doing your assessments as well too, you're going to be assessing the height of different structures as well too. So what I generally like to do, I'll come in, I'll assess shoulder height, okay, from the posterior view, my hands resting on both of her shoulders just to see if my hands are level. What's not on here, I also like to look at the elbow as well too. Sometimes in scoliosis, you might have a little bit of a trunk lean, which would kind of flare one elbow out a little bit more, or it might be closer to the body than the other side. So I like looking at the shoulders, looking at the elbows, then I'm gonna come down to her iliac crest, okay? And I'm gonna stand level with my hands, and I'm gonna be looking to see if we're level there as well too. I'll work my way down from her iliac crest to her PSIS, okay? And again, using my thumbs here, I'm looking to see if we're level, okay? Coming out to the greater trochanters. Are we level here? I'll go popliteal crease, and then I'll come down and look at her malleoli. While you're observing things, some of the things that you might notice is some scapular winging, okay, or the position of the scapula. Are the scapula level? Are they in the same plane, or is one a little bit more abducted and rotated away from the midline of her trunk? Also, noticing any scapular winging would be the medial border of the scapula kind of flaring out a little bit when she's standing. That would be, you know, indicating some kind of weakness or maybe a postural abnormality here. And then also in this position with the plumb line down, you're noticing as it falls down, do you notice any scoliosis in this position, okay? So this is what you're gonna assess in the posterior view.